I want to talk about concepts in the subconscious mind and how they manifest in the body. So let's say, for example, you have a patient come in, and ever since they're a little kid, their parents are telling them, you're delicate, you're weak, be careful, don't go out in the rain, don't go out with wet hair, whatever. So they have this idea that keeps being ground into their head since they're a little kid. You have a weak immune system, weak immune system, weak immune system. Now they come to you, they're 25 years old, they have a weak immune system, and you're giving them all these great adjustments, but they're not getting better. It's because you don't know how to address that aspect. You're just giving these physical adjustments, but remember, chiropractic is, like D.D. Palmer said, is physical, mental, and spiritual. True holistic, whole person, physical, mental, spiritual, body, mind, soul. That's not from me, that's from D.D. Palmer, the founder of chiropractic. Who knows more about chiropractic than D.D. Palmer? No one. He founded it, he invented it, he created it, he defined it. So, patient comes in, you're just addressing the physical. But if you don't know how to address the concepts in their subconscious and change the concept in their subconscious from weak immune system to strong immune system, you're not going to help them get a strong immune system. You might say, no, I had a few patients come in and they did get a strong immune system. Well, you did it inadvertently. I'm going to teach you how to do it right every time. Next thing is this. When you understand that a patient's body is just a reflection of the concepts in their subconscious, it makes your job a lot easier. For example, someone comes in with high blood pressure, the way I look at it is, their body is just manifesting the high blood pressure idea. Someone coming in with a weak immune system, their body is just manifesting the weak immune system idea. Someone comes in with digestive problems, their body is just manifesting the bad digestive problem idea. So if I know how to, beyond just the physical technique, if I know how to deal on a mental, spiritual level with the ideas in their subconscious, to change the idea. And if it's not that, you might think, oh, it's simple. You just tell a patient, oh, well, you know what? You have the idea that you have condition X, but I'm going to do so-and-so, then you're going to get better. It's not quite that simple. There's a science behind it. Now, again, if you're already an expert at that, you're all set. But if you're not an expert at it, I will teach you to become an expert at it. And again, like I've said in all the videos, results are what counts. So let me show you how to get amazing results. Let me show you how to have people come in with autoimmune situations, blood pressure situations, nervous system disorders, severe digestive disorders, and let me show you how to get them all better. I'll give you one example. I can give you, I feel like, thousands of examples of healings that would blow your mind, but I'll just tell you this one. Let this guy come into me, 18-year-old male, came in about a year ago or so. He had Crohn's disease. So, we're chiropractors. We don't treat disease. We don't promise like, oh, we're going to get rid of the Crohn's. I think it's even considered incurable by the medical community. I don't know. I don't even care. But I said, look, we're going to balance your body. Right now, your digestive system is not balanced. It's manifesting in symptoms that are called Crohn's. But what we're going to do is we're going to balance your digestion so your digestion can be awesome. This kid came in for, I don't know, several months, twice a week. Not several months, 3 or 4 months, twice a week. And after about, that amount of time, he came in once with his mom. His mom came with him. And she's like, I think you fixed the Crohn's. And by the way, Crohn's, you have to get a biopsy of your intestines to even prove you have Crohn's. It's not like you go to the medical doctor and say your digestion is off. They say, oh, I think you have Crohn's. This kid had a biopsy of his intestines, had Crohn's. She goes, I think you fixed the Crohn's. He has 0 symptoms. Should we take another biopsy of the intestines to prove it? I said, you can do whatever you want. I said, I wouldn't do it. I mean, obviously the kid's digestion is awesome. I think that's enough. But if you want to do it, do it. Anyway, they left. A few days later, I think he had like a hemorrhoid or something like that. He had to get some procedure. So they were in the area. They did take a biopsy of his intestines and no Crohn's. So you want to have the confidence to do stuff like that. You have to understand that healing operates on a physical, mental, and spiritual level. And if you don't know how to address the concepts in a patient's subconscious, you're starting your healing with both your hands tied behind your back. I will teach you how to do that. See you soon. In healing, there's the technique you do, but there's an understanding of an overall healing principle that supersedes the technique by thousands of times. Now, one thing you have to understand that in healing is there's the doctor and the patient, which you know. They have to know how to assume their proper roles in healing. And if you don't know how this is done, I don't care what technique you've studied, you will not get good results. In fact, if you understand what I'm going to explain a little bit about now, you will understand why healing works when it works, and you'll understand why healing doesn't work when it doesn't work. Now, the doctor is what's known as the originated factor. The patient is what's known as the executive factor. The doctor originates ideas of healing. The patient executes ideas of healing in their body. Now, the question is, how do you get the proper rapport between doctor and patient? If the doctor and patient don't have the proper rapport and the originator-executive relationship is not set up correctly, you will not get results. Now, you might say, I never even knew about this stuff, but I get good results sometimes. Yeah, you're doing it inadvertently, but I'll teach you how to do it consciously, which will make your results quadruple. Now, the question is, how does one get rapport with a patient? Two things: fascination and agreement. So, let's say a patient comes in, you have no rapport with them, and you do whatever you do. I don't care how good you are at it, they will not get better. However, if you have good rapport with a patient, the proper rapport, you can do what I would say is even a mediocre technique, and you will help them heal. Now, fascination and agreement. So for example, patient comes in to me. Now the zone technique will let you get a lot of fascination. Patient comes in, I go, hey, what are you here for? Neck pain, that's it. That's it? That's it, my neck hurts. Can you help my neck? Of course we'll help your neck. I say, but I'm gonna feel some points in the back of your head because the technique I do, those points tell me what's happening in your body, okay? I feel the back of their head for 10 seconds. I already know they have a circulatory problem. I go, hey, according to what I'm checking out, I think your circulation is a little bit off. Am I correct? Oh my God, that's right. They tell you they have high blood pressure. They're fascinated. They met you 10 minutes ago. They didn't mention it on the entrance form. They didn't mention it to you verbally. You're not psychic. You felt their head for 10 seconds and told them they have a circulatory issue, which you can help them with. The fascination is very high. The rapport is developing. Agreement is if someone's like, hey, I have migraine headaches. 5 of my friends had migraine headaches. They came to you, they all got better. Can you help me? Of course I'll help you. They already expect you to help them and you're confirming that you'll help them. That's agreement. So if you know how to use agreement and or fascination, you will create rapport. And if you have the proper rapport, 2 things happen. Now this is kind of advanced stuff, which I will teach you guys later, but I'll just touch on it at the moment. If you have rapport with a patient, 2 things happen. Number 1, what's called the trap door between their conscious and subconscious mind opens. Meaning, if you don't have a rapport, you talk, your words go from your conscious mind to their conscious mind, and they'll just disperse out into nothingness because you don't have a rapport. But if you have a rapport, there's a door that opens between their conscious and subconscious. And when you talk and you tell them what's going to happen, like, I'm going to adjust you and you're going to get better, your words actually go from your conscious, bypassing their conscious, into their subconscious. And ideas in the subconscious mind will manifest in the body. That's number 1. Number 2, this might be a little deep for some of you, but it's all right because this is how it is. There's subconscious to subconscious communication. When there's rapport and you give an adjustment, electrons travel from your subconscious through the ether to their subconscious. And if I believe what I'm doing is going to help heal so-and-so, it will, because of that subconscious to subconscious communication. You might be saying, wow, that's like, I don't even understand what you're saying. Okay, well, you may not understand what I'm saying, but you take the class, I'll make it super clear to you. And at the end of the day, it's about results. So when I teach you how to get the proper rapport, fascination and or agreement, when I teach you how to be the originator and help the patient be the executive, when I teach you how, when there is proper rapport, how the trapdoors open between the patient's conscious and subconscious, and there's subconscious to subconscious communication of healing, well, then the results you get are going to dwarf the results you're getting right now, and that's all that really matters.